Welcome to Have More Babies, where we really try to get into the information you share with us, helping you navigate the often tricky world of parenting. Today we're tackling something I think pretty much every parent stresses about eventually. What do you do when your kid gets sick or hurt and it's, after hours, when your regular doctor's office is locked up tight?
We've got this really interesting piece here from Omega Pediatrics called Why After Hours Pediatrics is the Future of Children's Healthcare, and we're going to unpack it. Okay, let's unpack this.
Yeah, and what's so interesting, I think, is how this hits on that universal feeling parents get, that moment of panic. Your child needs care, but it's outside the normal 9 to 5. And this isn't just about finding a quick solution. It's more about understanding how children's healthcare is changing, maybe offering a clearer path, a roadmap, really, to help you decide when and where to get the right care, which, let's be honest, could save a lot of stress and, frankly, maybe some money, too. Exactly. We've all been there, right? It's like 7 o'clock on a Tuesday or maybe Saturday afternoon, middle of a soccer game, and boom, your kid has a crazy high fever or they fell and their wrist looks just wrong. And that immediate thought is, okay, what do I do now? Do you wait, hope it gets better, or do you rush to the ER? Brace yourself for the wait, the big bill, maybe catching something else while you're there. Or, like our source here suggests, is there another option? Something smarter, maybe more specialized, built for exactly these moments. Because, let's face it, kids don't get sick on a 9 to 5 schedule. Never happens.
It's so true. And this isn't just about convenience for parents, though that's part of it. It really brings up bigger questions about how accessible and efficient pediatric care is overall. The article points to a solution that seems, increasingly necessary, these dedicated after-hours pediatric services. It mentions this model is really making waves, particularly in places like Georgia. So I think today we can really explore how these services actually work and why they might be the future, like the title says.
Okay, so let's get into it. What makes these after-hours places the smart choice when it's not, a life or death emergency? One big thing the source highlights is just the hours themselves, rethinking business hours. So unlike your regular pediatrician, places like Omega Pediatrics stay open later, the article says until 9 p.m. on weekdays. How significant is that simple change, really, in the grand scheme of things?
Oh, it's huge. It's a really smart adaptation, actually. If you kind of zoom out, these extended hours, they aren't just nice to have. They directly address how families live now. Two parents working, single parents, shift workers. Kids' symptoms often seem to get worse in the evening anyway, right?
Always.
So having specialized care available then means parents aren't forced to choose between their job and getting their kids seen. Plus, quicker access can often stop something small from becoming, a much bigger deal later. Maybe even prevent that ER visit altogether. It's sort of proactive.
That makes total sense. And you mentioned access. The article also talks about location being key. It specifically points out Omega Pediatrics being near public transportation. That seems like a small detail, but I guess it's really important for some families.
Oh, absolutely. Accessibility is crucial. When your kid's sick or hurt, you don't want hurdles. Easy transport, whether it's parking or public transit, just lowers that stress level for parents significantly. It's about being part of the community's health network, really.
Okay, so for parents in that moment wondering, can this place actually handle my kid's problem? The article lists out a whole bunch of things. Let's talk illnesses first. It covers a lot of those things that cause panic but aren't usually ER-level emergencies. Things like asthma attacks, allergies, bronchitis, colds, flu, dehydration, which can be scary diarrhea, nausea, food poisoning. Also headaches, ear infections, the bane of toddlerhood, pink eye, poison ivy, sore throats, strep, stomach flu. It's a pretty wide net.
It is, and having that list spelled out is, I think, really empowering. It means you're not just guessing in a stressful moment. You can see, okay, yeah, this matches what they handle, takes away some anxiety. And it's not just illnesses, right? The article goes into injuries, too.
Right, because kids and injuries, they go hand in hand, especially after school or on weekends. The source says they can handle things like bone fractures and breaks and often have x-rays right there, which is huge. Also burns, bee stings, wasp stings, cuts that might need stitches, even dog bites or other animal bites. Then there's stuff like ingrown toenails, neck pain or whiplash, nosebleeds, spider bites, even toothaches. It really covers a lot of ground for those unexpected ouches.
And that's a key difference from a standard pediatrician's office, right?
Yeah.
They usually aren't set up for immediate diagnostics like an X-ray. That capability lets these clinics function as that important bridge, keeping less critical cases out of crowded ERs. And speaking of ERs, another huge point the article makes is the cost.
Ah, yes, the cost.
For these non-life-threatening issues, going to an after-hours pediatric urgent care is significantly cheaper than an ER visit. Dramatically so, often. The piece even touches on telemedical options for things like pink eye or rashes, which many insurance plans cover now, so you might not even need to leave home.
That cost factor is massive. But okay, here's where it gets really interesting, something I didn't expect. The source talks about more than just pediatric treatment. What does that even mean? It suggests like you could get your own DOT physical or maybe even an STD test done while your kid is there for, say, an ear infection. Is that right? That seems revolutionary for busy parents.
It's incredibly innovative, isn't it? It really speaks to this idea of these clinics becoming more like integrated family health hugs. Think about a parent's most precious resource is probably time. Being able to bundle your own and necessary checkup or test with your child's urgent visit, that optimizes time in a way traditional healthcare just doesn't. It also sort of hints at a more holistic view of family health, recognizing that if the parent is healthy and has their needs met, they're better equipped to care for the child. It definitely feels like a glimpse into the future of family-focused care.
Wow. Yeah, that really changes the perspective. Okay, so this all leads to the big crucial question, doesn't it? How do you know? How do you make that call between urgent care and a full-blown emergency room?
Right, and the article is very clear on this.
Yeah.
The ER is for true emergencies only. Choosing the right place isn't just about efficiency. It's about getting the right level of care, avoiding unnecessary exposure in crowded waiting rooms, and frankly, helping the whole system work better.
So we need that clarity. Let's get specific, straight from the source.
Yeah.
When must you go to the ER? Okay, number one, severe allergic reactions, especially with nausea, vomiting, trouble breathing, or if your child seems out of it, less responsive. Extremely high fevers, and this is key for infants 2 months old or younger, anything over 100.4 Fahrenheit is an immediate ER trip. Severe dehydration, look for extreme thirst, unusual drowsiness or lethargy, feeling cold, rapid heartbeat, breathing difficulties. That means a bad asthma attack, really bad chest pain, passing out, coughing up blood. Those are ER signs. Keep going. This list is critical. Okay? Large wounds that just won't stop bleeding. Severe bone fractures, like if you can see a bump or something looks deformed, or worse, if the bone breaks the skin. Serious burns from fire, hot liquids, chemicals, electricity. If the skin is red-pink, super swollen, blistered ER. Any kind of poisoning, swallowing, or touching something hazardous, immediate ER. Head injuries are a big one. Loss of consciousness, seizures, any change in mental state, a fever with a headache and stiff neck, or sudden changes in speech, vision, walking, or movement. All ER. And finally, a very serious one. If a child talks about wanting to hurt themselves or others, that requires immediate emergency intervention. The source also adds, if you can, aim for a pediatric ER. They often have the specialized staff and equipment.
Having that list clearly in mind, it's powerful. It cuts through the panic, helps you think rationally when time is critical. So conversely, for those less severe things we talked about earlier, that's where the pediatric urgent care like Omega Pediatrics really shines.
All right, so just to recap that side, what are the things perfectly suited for the after-hours clinic?
Well, like the article lays out, fevers and cold symptoms in kids older than 2 months. Common infections, think pink eye, strep throat, those ear infections again, minor injury strains, sprains. Remember the on-site X-ray capability? That's huge for quickly diagnosing these. Things like stomach pain, UTIs, bug bites, rashes, cuts, or burns that probably need stitches but aren't catastrophic. Essentially, it's matching the problem to the right resource. And for a whole lot of common kid issues, these clinics are the right resource.
Okay, so what does this all mean? For you, the parent listening right now, maybe dreading that next unexpected illness. The big takeaway seems to be that after-hours pediatric urgent care is like this essential middle ground, a bridge. It offers specialized kid-focused care that's way more accessible and much less expensive than the ER for so many common problems. But it also helps you know when something is truly serious and needs that hospital-level care. It's about making the smart call for your child, your wallet, and your sanity.
Well said. And I think this discussion, it highlights more than just a service. It points to a shift, doesn't it, towards more proactive, more responsive children's health care. Thinking about these options before you need them, knowing they exist, it can seriously reduce family stress. It gives parents a plan, makes those inevitable sick days or minor accidents feel, well, a lot more manageable. You feel more in control.
That's a really positive way to think about it.
Yeah.
Feeling more in control. I like that. So we've covered a lot. The convenience, the range of treatments, the cost savings, that's surprising more than just PED's angle. And crucially, knowing when to choose urgent care versus the ER. It's about having a clear path. Now, if you want to dig deeper into these services, get more details, and explore everything we've talked about today, we definitely encourage you to visit omegapediatrics.com. That's OMEGA pediatrics.com. All the info's right there. And hey, if this conversation was helpful for you, if you found it valuable, please do us a favor. Hit that like button, subscribe to the channel for more discussions like this, and maybe share this with other parents or caregivers you know. Spread the word.
Thank you so much for joining us for this deep dive today.
Yeah, thanks for listening. Stay informed and stay well out there.
We'll catch you next time on Have More Babies. Goodbye.